Hey dancers, welcome back to the Unchoreographed podcast. I am your host, Dr. Jenna Lower, and if this is your first time joining us here on this podcast, this is where we talk about all things dancer health and wellness, and I'm going to give you actionable tips and steps to create a more sustainable and healthy dance career. Today, we're going to switch things up a little bit, and I'm going to do my first solo episode. So usually when I do these episodes, I have conversations with other dance medicine professionals, but I decided that there are so many things that I want to share with you guys that it's so much easier for me to be able to give you sort of bite-sized bits of information with some solo episodes. So I'm going to be mixing in some of these episodes in order to give you guys some real-time information on topics and discussions that I'm having with my own dancers in the clinic. Pretty much every time a dancer or a patient walks through my doors, I get an idea of something that I want to share with you. So I figured instead of waiting to talk about it with you with a guest, that I would just start doing these solo episodes. And this way it won't be like an IG story that's going to disappear in 24 hours. You guys will have a dedicated space to get all this information and see it all in one place and be able to refer back to it. So to kick off these awesome solo episodes, I thought we would start with a really important topic and really the entire reason that I am here, which is why it is so important for you as a dancer to have a dance medicine specialist and somebody that understands what you're going through. So let me back up a little bit more. If you guys already know who I am, or it's your first time listening, I want to give you a little bit more information about who I am and why this is so special to me and why I'm so passionate about this. So I've been a physical therapist and a dance medicine specialist for just over 13 years now, and I have seen a lot. I started out working with dancers when I was basically in school, and I pretty much haven't stopped since. So it's been just over 13 years now. And I truly can remember the time that I got completely hooked on dance medicine and like this was going to be my path forever. And it was just after I had graduated. I was working in Rochester, New York at a clinic that sort of specialized in dance medicine. And so we were the clinic that worked with the Rochester City Ballet. So we did all their backstage for their shows. And about 6 months or so after graduation, I was working my very first Nutcracker. I was backstage with them. And they did it at the Eastman Theater, and it's this gorgeous theater right downtown Rochester. And the backstage of it is like built up. It's really funny. It's like you have to go up probably like 3 flights of stairs to even get to the PT room and the green room and all of that. And so I was working that show, and I made my way down the stairs at the end of Act 1, and I watched Snow from backstage, which already is like one of the most magical dances ever. But it was honestly, like the most magical thing in the world. I know it sounds really corny, but it's true. I can still remember standing there watching that and just feeling like I'm going to do this forever. If I can't be a dancer, I'm going to be involved in this community, and I want to be backstage in the wings watching and helping these dancers in real time. And I was just totally hooked. And honestly, it is still to this day my very favorite thing to watch backstage because it still brings me back to that moment of like just completely falling in love with being a dance medicine physical therapist. And so, yeah, I've really dedicated my entire career on dance medicine since then. And to be honest, I've had a lot of people along the way tell me that it's probably not possible. You're not going to be able to have a clinic that just focuses on dancers. There's not enough dancers out there. It's not a big enough problem to be able to run an entire clinic off of. And I obviously knew otherwise. I knew something different. And I think hopefully you guys know the difference that we know something that everybody else doesn't. And that it's that there's a huge need for this in the dance space. And so now you look, fast forward 13 years, and I do own my own practice, and I do specialize in, I'd say about 90% of it is dancers. But yeah, so this is On Point Wellness and Rehab. I'm here in Gainesville, Virginia, and it's been a really successful run at it for the past, I guess I've been open now for 8 years. So it's been a while. And so I have worked with all varieties of dancers. I've worked with everything up from like young kiddos, first time, getting the first pair of point shoes, all the way up through working with professionals. I do all the backstage work. I'm the physical therapist for Manassas Ballet. Yes, I did watch Snow from backstage again this year and had all the same feelings. But yeah, I've seen this really wide range of problems within the dance world. I've had all types of injuries come through the door, questions that dancers have. And what I really have learned over the years is that there truly is a void in the dance space that needs to be filled with knowledgeable practitioners, and that also just dancers really are unique. The way that they move and train and push their bodies outside of their comfort zones and to the limits really is different from a lot of other athletes. We know that that means then that they need a different type of care. They need people who understand what is going on. And that is where a dance medicine specialist comes in. So if you think about all the unique demands that are placed on your body as a dancer, you've got working in turnout, high, leg height, extensions, the leaps, being able to do all of that. And then on top of it, make sure that it looks effortless, right? Like there's the artistry, not just the athleticism, and make it look effortless. I'd like to see a football player make what they do look effortless. It's not an easy thing to do. And then on top of that, the techniques and the things that you're having to do, they're only getting more complex, right? The tricks and things. I could not keep up today if I was still dancing. I, danced a long time ago now, and the tricks and the way that things have changed, it's much more intense on your body now than it used to be. And then you look at the scheduling, right? The schedules that you guys hold as dancers are absolutely grueling. Not only the schedule within a week and how many classes you're taking and how many hours you're dancing, but looking at like the fact that there isn't really an off season, like normal athletics, there's a preseason, in season, postseason, like all of this kind of like works within the course of a year. But in dancers, it is a year-round schedule, and you don't really get a lot of breaks in there. You throw in performance times kind of sporadically throughout the year instead of into one condensed competition season. They're kind of like spaced out throughout the year, which then we've got, all the added rehearsals that go on top of pretty much schedules that are already jam-packed. And so there's really intense times throughout the year. And it's a lot, right? Like it's really, really overwhelming. You as professional dancers are probably juggling jobs and families on top of the schedule that you're holding. If you are, a high school age dancer, you're juggling school and getting enough sleep and your friends. And so it really is a lot. And it is no wonder that I see so many dancers who have had nagging pain and injuries that seem like they just won't go away. And burnout. Ultimately, like we see a lot of burnout in our dancers. And so, again, we need people in the healthcare space that really understand that this is what a dancer is going through, and looking at not just the physical demands, but the emotional toll and emotional demands that it takes, and kind of looking at the person as a whole, the dancer as a whole. What I find is even like kind of the biggest problem is that there really doesn't seem to be great support systems in place for dancers. Many of our studios and companies, they don't really have a team of healthcare providers or even partners within the community that they can refer their dancers to. So if, a studio owner is referring out, they say, go to the doctor. Most of the time, the general practitioners that these dancers are going to go to, or it might even be a sports medicine specific doctor, they don't actually understand the demands that a dancer is under compared to the traditional athletic population. And so you might be getting information that isn't the most up to date or the most effective information. I hear all the time a dancer has gone in to a general doctor or a general ortho, and the advice that they were given is to rest it, ice it, put a boot on it, don't dance for the next 3 months. And while I understand that advice is well-meaning, they only want you to get better, it's really not realistic. And to be honest, we can do better than that. And we know better. There's so much more science involved and research now in the dance medicine space. And so we know that there's better advice that our dancers can be getting. And the truth is, like, if you're a dancer, getting sidelined isn't, I mean, it's frustrating. It's super frustrating for you, but it also can feel like, your entire identity is wrapped up in you as an artist. And so to be able or to not be able to then go do your art, it really can make you feel like you're at a bit of an identity loss. And the emotional struggle that goes along with that, the fear and the frustration that goes along with not being able to perform is really difficult to manage sometimes. And so again, we have to make sure that you have a team of healthcare providers that understands that whole picture. When you find a dance medicine specialist who gets it, it is a huge sigh of relief. I have seen so many dancers or their parents come into my office, and when they find me, they are so emotional about the fact that they finally made their way here and that somebody is finally speaking their language and giving them a clear path and plan to their recovery versus just saying, don't dance, don't lift your leg as high, wear this boot, whatever it is. It can be a really emotional thing to finally find somebody that understands what you're going through and can speak your language. I think, ultimately dance medicine specialists approach things really differently than a normal physical therapist would because we get it. We understand what you're going through. Most of us have already been there ourselves. And so we understand the pressure that you're under and the frustrations that you are feeling deep inside. We know that you can't just stop dancing. Like that's not going to be the solution for most people, especially for 2-3 months, like sometimes the recommendations are. So our job instead is to figure out ways that we can keep you in the studio, moving, getting stronger, but doing it under conditions that still allow you to safely heal and not putting you at risk of, further injury or damage. And honestly, that's ultimately like why I am so passionate about what I do, because it's not about just like fixing the injuries for a dancer. It's about empowering you to be able to dance stronger than you were before and have long careers and be smart about the way that you're taking care of your body. And watching a dancer move from like not really understanding that and not having a support system that's teaching them that into this space of like getting it and being empowered to take their wellness into their own hands. It is one of the coolest things ever as a dance medicine specialist, and I just absolutely love it. There's a lot of different forms of dance medicine when we look at, who is a specialist. There's obviously, like myself, we have physical therapists, we have chiropractors, athletic trainers, and then we have people who are just personal trainers and Pilates teachers and yoga instructors and things like that. We also have, on the healthcare side of things, we obviously have a lot of orthopedic doctors who are dance medicine specialists. We have nutritionists. So there's this wide range of who is a dance medicine specialist. And so there's kind of somebody for everything, somebody depending on what you're struggling with. If it's a mental issue, we have dance sports psychologists and therapists. So really there's somebody for whatever you're going through. It's just about pairing you up with the right person for your issue. So obviously I'm going to focus a little bit more on the PT side of things because that's what I do, and sort of what we can do in the physical therapy realm with dance medicine, but just know that there's like so many other options out there and different types of specialists that can help you. So we've sort of talked about like, obviously we have an injury, we're going to keep you dancing, and like, what do we do to keep you dancing? But then one of the other key things that we focus on, especially in the physical therapy realm, is prevention and making sure that you sort of know what to do before you actually get injured. So many of the injuries that I see in here could absolutely be avoided with the right preventative strategies, whether that be strength training, learning recovery and how to reduce overtraining, and just knowing how to listen to your body before it actually starts to break down. I usually will refer to myself as a dance performance coach in addition to a physical therapist, because my job is to sort of guide you through not just the injury recovery, but also like What do you do on the back end after you're recovered? Or what if you don't have an injury and you still want some performance training? I kind of want to guide you through that process before the problems ever even start versus just patch you up once there's an injury or a problem. So yeah, I think there's a lot of people that will refer to themselves as like a dance performance coach. And I think, you're seeing that pop up a little bit more, but that's basically what that means. There's, we're still healthcare providers, but we're coaches and all the things in between. So probably what is going through your mind right now is, well, I'm not injured. Why would I really need to go to a dance medicine specialist? Or why would I really need to see a physical therapist? Like, you're for injuries. And the truth is, like, well, that's not true, basically. So if we were to put it this way, and this is often the analogy that I'll use with people, is you don't wait until your car breaks down to get an oil change, right? You do the oil change preventatively. It doesn't make sense to let your car completely break down on the side of the road. You just do the preventative care. And so that's exactly what we want to do with our bodies. We want to make sure that everything is running smoothly and that we're catching these issues before they actually turn into big issues. And so that's sort of what the preventative side of things is for. And so I urge every dancer to have a physical therapist on speed dial and somebody that you can trust to ask questions to and have regular check-ins with, because it will help prevent a lot of those issues from arising down the road, and making sure that none of your injuries turn into anything bigger than little blips in the road. My best advice would be, like, if you're on the fence about working, like, should you work with a dance medicine specialist or not? My advice would be just do it. Don't wait until you are, having to sit out of class with an injury. Do it ahead of time, get the assessment, and at least get a plan for what, a healthy career looks like, get some tips on overtraining, recovery. I mean, so many things, but have a plan in place. And that way, if an injury does come up, like, you already are sort of covered and you're not scrambling to get fixed so that you can compete this weekend. You already have a plan in place, and it will help you make sure that you can deal with things a lot faster as they come. I'm going to give you a little bit of a rundown of sort of what happens for me, like when a dancer comes into my clinic, of sort of like the process that I take them through, because I think it's really helpful for people to hear like a real life example of what does it look like to work with a physical therapist and what types of things might we be seeing. So I had a dancer, and this is actually a really common thing, right? But one dancer in my mind that's kind of sticking out is I had this dancer come in. This was probably it was probably about a year ago. And she came in with a boot on for an ankle injury, and she had sort of been having pain on and off for about a year, as many of our dancers do. A lot of times dancers wait until the very end to seek out care. So she had come in, she'd had this boot on and off for about a year and just could not get the pain and the injury under control. So basically every time what would happen is she would take the boot off, is she would end up going back to dance and ending up back at square one, back in pain. So they put the boot back on her. She'd take another, 6 weeks off, take it off again, and end up in pain as soon as she went back to the studio. And so in her eval, as I was really kind of talking with her about this whole process and her whole history, she basically told me that she had already tried, I think maybe at least one, maybe two different physical therapists, and she had tried a couple different doctors, and really it had taken her 6+ months to even get a concrete diagnosis. She kind of had been bounced around between all these different healthcare providers and really just wasn't able to dance, and the pain was becoming debilitating and was being sort of bounced around with no clear answers as to what was going on. So she was kind of just like doing her own thing, trying to dance when she could. She had no plan of what was going on, and would just see what she could find on the internet or, listen to what her teacher might be telling her, but really didn't have anybody that was guiding her through this process. So she was feeling extremely lost and depressed and just not feeling very hopeful that she was ever going to be able to dance without pain again. So I'm sure, like, if you're out there struggling with an injury, these might be things that you're saying like, oh gosh, that sounds like me. Because this is a really common occurrence for a lot of my dancers. So just remember, you are not alone if you are also experiencing this. So when I started working with this dancer, we kind of worked on all the usual stuff. We did immediate things to help with like her problems, acute symptoms in the moment. So manual therapy, hands-on stuff. We did some corrective exercises. And then most importantly, we were doing a lot of dance technique assessment and then corrections pretty much right from the beginning. So already there's a very clear correlation and connection between there's this muscle weakness, this is how it's presenting in my dancing, and here's how I can correct it and fix it. And with that, again, I think that's a really hopeful thing for a lot of dancers to already feel like, oh my gosh, somebody's pulling my dancing into my rehab right from the beginning. And so in her case, she started feeling improvements almost immediately of us working together, and started getting that relief quickly. As with any injury, I'm sure you can relate, but the pain still was sort of up and down. But ultimately, she was able to progress herself back into dancing within a couple weeks, where before it had been months without dancing. And so really my job there was to just give her very clear guidance and support from somebody who knew what was happening in the studio. And I was able to give her a very clear plan of progression on like, here's what you should be doing, here's what you should be avoiding, here's how you can modify certain things. And in the meantime, connecting and communicating with the dance instructors so that they know sort of what the plan is and everybody's on the same page. By the time she got back to 100% dancing, I mean, the emotional change within her obviously was unmatched. I mean, she was a completely different dancer when we finished working together as when we started, just because she was finally feeling lighter and more hopeful again and in control of her symptoms and her pain, and really understood what to do to keep herself out of, going back to this place where she couldn't do anything. So she knew what to do to prevent that from happening again. As with most of my dancers, our work didn't actually end there. We kept working together over the course of the next couple months to get her beyond what her baseline level of strength was. So we sort of transitioned, and this is what most good dance medicine specialists are going to do with you. We transitioned from rehab to performance-based dance training. And she actually was able to get back into the gym to do a strength and conditioning routine, complemented with like some at-home things. She obviously was back fully dancing at her studio. She got a leading role in her upcoming dance performance. And realistically, she was back stronger than she ever was at her pre-injury level. And so she is absolutely thriving right now. We still check in periodically and do like quarterly check-ins. Some of my dancers come in monthly, but we're kind of at that quarterly standpoint, and she's thriving and really is way better than she ever had been pre-injury, and doing things that she didn't think she could even do before she had this injury. So again, I mean, this is what makes me so passionate about what I do, is that these injuries feel like they can be the end of the world, but the reality is you are not broken. You do not need to be hopeless. There are people out there that can get you performing better than you ever thought was possible, whether you have an injury or not. Maybe you're just looking for performance enhancement, and that's what a dance medicine specialist is going to help you with. We're going to give you tools, education that you need, obviously the hands-on care that you need to help you progress beyond just like the traditional sense of rehab, which is what, maybe a traditional physical therapist is really good at. But then you hit the performance specific things and they're kind of tapped out. They don't really know where to go from there. And so your dance medicine specialist, we are here to help you create a sustainable whole body routine that's going to help prevent things like overtraining, prioritizing your recovery, making sure you have a clear plan sort of laid out for the year as to like, what do I do leading up to performances versus if I am in a lower, off season versus summer intensives, all of that. We can kind of come up with this really comprehensive plan outside of just the traditional sense of what rehab is. And you will not get that from any other healthcare provider unless they understand this world. I truly believe that every single professional company needs to have a healthcare team in place, on staff for them. I think that every studio needs to have partners within the community, or partners that they can dance medicine in the dance medicine community that they can be referring to regularly, even if there's not somebody local, but it's somebody that you can connect with remotely. We need to have these teams of healthcare professionals in place to get a support system for our dancers. I mean, if you think about it, professional athletes, they have teams of people and trainers and therapists and psychologists and all these people that are keeping their dance or their athletes performing at a high level. And then what do we have in the professional dance world? We don't have any of that. I think it's becoming a little bit more common, but it's definitely not the norm. And so this is something that I'm super passionate about, and I truly believe that every company should have in place. We actually talk about this a little bit more. If you listen back a couple episodes, I talked to Jen from Doctors for Dancers, which I'm totally repping them today with my shirt. But we talked about this in our episode a lot as well. So go back a couple episodes and listen to that if you didn't already. That was a great episode I had with her. But yeah, I think overall, when companies and studios are prioritizing their dancers' health by partnering with the dance specialists, it really changes everything. We see lower injury rates. We see careers that are much longer and healthier. Dancers are much healthier. They know and understand how to push their boundaries safely, and they have a support system in place for not only the physical side of things, but the mental toll that a career like this can take on a dancer. I myself have been really fortunate to work with a few studios and companies who get this. They understand this, and we've been able to build some really, really amazing partnerships in my community here. And I will tell you, the difference is incredible. The dancers feel seen and supported, and they are so grateful that you are there. It reflects into their performance. It reflects on their injury rates. The companies as a whole are much happier when they have this team and this support in place, and same goes for the local studios as well. So if you are a studio owner or a teacher or a director and you're listening to this, if you're a parent who's listening to this, I would strongly urge you to consider starting to build some of these partnerships into what you offer in your studios and your company. It might be just, inviting a dance medicine specialist in for the day to do a workshop, or to have within your referral network if you need something. But starting this conversation with the dancers, with the dance medicine specialist, to be able to start to prioritize your dancer's health within the studio is going to be a really important step for you to take to kind of get to that next level and make sure that you're staying up to date with the modern times and the way that the resources that are out there and are available to you. If you need somebody, obviously I am always willing to answer questions and, connect you with the right people. So I will make sure that all of my contact info is linked below as well. And please do not hesitate to reach out to me. I also, today in the show notes, I'll link the information for Doctors for Dancers as well, because that's a great resource if you're trying to find a dance medicine specialist within your area. There's all different types of specialists listed up on that website, and you can find somebody, again, that's either local or works with dancers remotely. So that's a really good resource for you guys. So just to kind of wrap things up today, I'm going to leave you with this. I want you to remember that you are not just a dancer. You are an artist, you are an athlete, and your body is your instrument or your tool. And so taking care of yourself and self-care, it's not a luxury. It is something that is 100% necessary, and you just need to listen to your body. And so being able to connect with a dance medicine specialist is going to make sure that that happens. And we are all here. We are here waiting for you. We can't wait for you to get into our clinics and to meet with you online. So we want to connect with you. So please don't ever hesitate to reach out to one of us. Just start building that team and that network of people to be on your side. Like I said, I will link all of our information, so you can reach out to me, you can reach out to Jen over at Doctors for Dancers, and we will get you covered. Thank you so much for joining me in this first solo episode. I hope you guys got something out of this, and if you've been on the fence about working with a dance medicine specialist, hopefully I have changed your mind and helped you understand the importance of working with a specialist versus just your general physical therapist or practitioner. Find somebody that understands what you are going through. If you guys feel like if this episode resonated with you, please share it with your dancer friends, dance parents who need it, studio owners who need it. Tag me on Instagram. I want to know that you guys are out there listening or watching. And please, if you can, leave a review. I love to connect with you guys, and those reviews are a great way to do it. Let's essentially try to keep this conversation going. I'm here to support you every step of the way. If you have any questions, don't hesitate to reach out, and I will see you back here next week. Have a good one, everybody.